Please watch all the way to the end. Don't forget to like and subscribe. Please leave a question or comment at the end. We'd love to respond. Don't forget, please check out our website at www.mypfi.org. Hi, I'm Dr. Lennox Hoyte, fellowship-trained urogynecologist and pelvic reconstructive surgeon. We're talking today about fistula, and if you've never heard the term, a fistula is nothing more than an abnormal connection between two, what we call viscera. So viscera are tissues and organs on the inside, like the bladder, for example, is a viscera, the bowel is a viscera, the vagina is also considered a viscera. So if there's an abnormal connection between the bladder and the vagina, that's called a bladder-vagina fistula. The fancy term is vesico-vaginal fistula. If there is an abnormal connection between the rectum and the vagina, that would be called a recto-vaginal fistula. And there also can be abnormal connections between the bladder and the uterus. The bladder and the rectum and the uterus, all of those are fistulas. The risk factor, the big risk factor for those tend to be surgical. If you had prior surgery on the bladder, for example, prolapse repair, mesh surgery, and so forth, you can be at risk for fistula. If you had surgery on the rectum, you can also be at risk. Some women that have C-sections have abnormal connections between the bladder and the uterus. That's called a utero-vesical fistula, for uterine bladder fistula. So by its other things that cause fistulas include radiation. So I'm Dr. Lennox Hoyte, fellowship-trained urogynecologist. And there we have it. Fistula, abnormal connection between two viscera. The definition of viscera is tissues on the inside, organs on the inside, like bladder, like uterus, like vagina, like those are not supposed to be connected to each other. And if they are, that would be called a fistula. Treatable, it's very treatable. We have lots of patients with those complaints here at the Pelvic Floor Institute in Tampa Bay, Florida. Please remember to like and subscribe. Leave a comment in the comment box. If you think you may have an abnormal connection between the bladder and the vagina, vesico-vaginal fistula, or other kind of fistula, please feel free to visit our website. We'd love to see you and take care of you, and we'd love to help. Lennox Hoyte, MD, urogynecologist. Thank you for watching.
So a fistula is nothing more than an abnormal connection between two hollow organs. So ways to have fistulas is you can have a fistula between the intestines and the bladder. You can have a fistula between the bladder and the vagina. You can have a fistula between the rectum or colon and the vagina. Or you can have a fistula between the colon and the bladder. So a fistula is just an abnormal connection between two hollow organs or two hollow viscera.
Don't forget to like and subscribe. Please leave a comment or question. We'd love to respond. Don't forget, check out our website at www.mypfi.org. Thank you for listening.